delighted and honored to be here today. And I have the fantasy that out there in the people who are sitting and listening here, maybe there are some people who, like myself, are working with patients and wondering always, what can we do to add extra value? The things we're doing, maybe they're working partially, maybe they're working, but there's side effects. Sometimes, of course, we get people totally better, but more often we help them part of the way. And we're always looking for that extra 10%, 15%, 20% that's going to make them feel really good, not just a little bit. As the former introducer said, hospital is not just a place where you get sutured, should be a place where you get nurtured. And I think that is the same for all of medicine. We just don't want to fix, we want to promote wellness, we want to make people even better than what they are. And sitting with patients for 32 years in my clinical practice, every very once in a while something comes along that just knocks my socks off. Doesn't happen often. Happened 30 years ago when I came across light therapy, which was not previously understood to be valuable at all. And in fact, there was quite a lot of joking about light therapy when I first came up with it. But now, as we know, it is included in manuals of treatments for depression, for seasonal affective disorder, for daily rhythm problems, etc. And so imagine my excitement when some few years ago I came across something else that made me just as optimistic as the light therapy did, namely this particular brand of medication, transcendental meditation or TM. I had done it myself many years ago, back in the 70s. As they say, if you remember the 70s, you probably weren't there. But I was there, and I remember when the Beatles went to Maharishi to learn TM, and I thought, wow, that's very cool. So I did it too, but I dropped it pretty soon. I was a medical student, and I had a couple of other things on my mind. But 30 years later, I'm sitting in my office, and a young man with bipolar disorder says, you know, I have found something that has really made me happy 90% of the time. He says, your medicines, they're very good medicines, didn't want to hurt my feelings. They've stabilized my moods, I'm not manic, I'm not depressed, but you know, I wasn't really happy until I started to meditate. So we got to talking, and I thought, well, you know, this is worth another look. And bit by bit, I practiced it myself, I recommended it to other patients, I got a couple of research grants to study it in bipolar disorder and post-traumatic stress disorder in our returning veterans. And by the time I have, in fact, been running for the last 10 years my own clinical research organization, by the time those research studies were finished, all the clinicians in my group had gone for training to get their own TM training. That's how impressed they were with what they saw in the patients. So I thought, wow, you know, this is really unusual. And that's when I hit the research on the subject and saw literally hundreds of peer-reviewed articles showing a vast array of effects that had been very solidly documented, published in high-impact journals. And that's when I broke a vow that I had made, which was never to write another book. Because for those of you maybe who have or haven't written a book, I can tell you it's truly a pain in the neck. And only do it if you absolutely are compelled to do it. That's the indication of how compelled I felt to write this book, because it moved me so much. I thought this is something people really need to know about it, and it mustn't just be up there on the shelf alongside every other thing that one can do. Because, you know, when we're confronted with people who are suffering and desperate, we really do have the instinct to throw the kitchen sink at it. You know, today it's goji berries, tomorrow it's acai berries, the next day it's something else. There are 10 kinds of massage, there are 10 kinds of meditation, there are 10 of this and 10 of that. So where, and it's all done with the utmost goodwill and, anecdotal stories of people who benefited. How does one kind of sift through it all and pick, because we've only got a certain number of hours in a day. And it seemed to me once I'd seen the research, which I'm going to present to you shortly, that this was something that everybody had to kind of see as somewhat separate, simply because it's being so thoroughly researched. Without further ado, here is the name of the book. I have copies there and I'm happy to sign them afterwards. Healing and transformation. Healing is actual physical healing, and transformation is changing somebody's life. Not just, I'm feeling a little bit better than I was before. That's not transformation. It's, I'm really feeling like a new person. What is transcendence then? Well, when I first heard about transcendental meditation, I heard there was a fourth state of consciousness, beyond sleeping, waking, or dreaming. And I'm a skeptical person, and it seemed very woo-woo, new agey to me. But in fact, having now meditated for several years and spoken to many, many people, when you go into meditation, and the technique is a simple one. It involves sitting for 20 minutes twice a day in a comfortable chair, and you have to be trained by people who are trained to teach it. It's a one-on-one thing. It's not, so the book itself, it's not like I say, it's not a how-to book. It's a why-to book, because there's so many things that are competing for our time in our day, that before we make that commitment to spend 20 minutes twice a day, we have to be pretty sure that this is going to be worth our while. And the book lays out the case for why I think it is. My why, at least, and other people's perhaps as well. So you go to the teacher, you get trained, you learn how to use a sound or mantra, you sit comfortably, and you kind of think the mantra. And part of the trick is not just really the mantra itself. The magic is not just in a word. The magic is, the power is in the actual technique of how to use the words properly. And once you do this twice a day. As you get practice, in the process of thinking the mantra, you slip into a state. One of the ancient writings says it's the mind within the mind beyond the mind. You find you're awake, you're alert, but you're very calm. And even though you're awake, there's no actual content. It's not like you're thinking, oh, I've got to do this later today, or what fun I had last night, or whatever. Because you're awake, you're alert, but there's kind of no actual thoughts there necessarily. Thoughts can come and go, but the key is, in this particular pure state, it's this pure state of consciousness. If a pin dropped, you'd hear it. That's kind of how alert you are. But at the same time, your body is so settled and calm, and that is the state of transcendence. And it's very, very pleasant, and unlike any other kind of pleasantness. I've asked some people to describe what would it be like, and some of the descriptions are in the book. One that comes to mind is by the actress Laura Dern. Some of you may know her. And she said, you know, if I had to describe it, I would say it's almost like lying out on the beach after you've had a swim. And there's just a gentle breeze, and you almost want to take a nap, but then you don't take a nap, because you kind of get captured by the moment, by the salt air and the breeze and the sun, and you just go into this really lovely place. That's the closest I can get to describing what it's like to be in the transcendent state. What I have here, which I don't expect you to read, is simply 3 different categories of meditation. One is focused attention, one is open monitoring, and the other they call automatic self-transcendence. Now, focused attention is where you have a particular target that you return to again and again in your mind. Maybe it's a candle flame, maybe it's a mandala, maybe it's a thought or a prayer. As your mind drifts off, you bring it back. That's one form. The second is open monitoring. Mindfulness embraces this technique. You monitor your breathing, you monitor your feelings, you monitor your moment-by-moment thinking. In fact, both of those techniques have been packaged together in the technique of mindfulness. But very different from that is the use of the mantra in the TM technique. And all I'm really saying here is that not all meditations are the same. They're all different. So when somebody says, I meditate, and somebody says, oh, yeah, I meditate too. And the third person says, well, so do I. You could all be doing something completely different. And it's important to understand that. And in fact, they all have different brainwave effects, which I haven't gone into here. This is just the steps that you learn. There's several meetings. They really, these teachers at TM really try to see that you get the hang of it. And you know, it's a very, very simple technique in that almost anybody can get it. So then the first question is, well, if it's so simple, why do I need a teacher? Well, it's one of those things that it's like a knack or a practice art that, I mean, all of us can swim. Hopefully. But we had to be taught initially. And in fact, I even compare in one point of my book, Swimming to TM, because I don't know if any of you remember that first time you were able to get your feet off the bottom of the swimming pool and you were actually able to float and propel yourself. So that's a little bit, it's a threshold event. First you're kind of walking on the bottom of the pool and then you're buoyant, you're swimming, and you're not drowning, and you're not suffocating, and it's amazing. And that was the kind of threshold event when I first felt, now yeah, this is the transcendent space, this is what they've all been talking about, and it's kind of really different. So it's something everybody can do, it's simple, but it needs training and it needs practice. Like any other form of art. The brain during meditation is quite fascinating. It is bathed by calming alpha rhythm waves, and they especially come sweeping across the prefrontal cortex of the brain, which has been called the brain's CEO, because that's the part of the brain that makes judgments, that makes decisions, and that's being bathed in these calming alpha waves. And there's also what's called an increase in coherence. Brain coherence refers to the way the brain waves of different regions of the brain relate to one another. That the higher the correlation across brain regions, the higher the level of coherence. And this is what is promoted in the transcendent state and between transcendence. Higher coherence, more competence. Athletes that are higher up in the food chain show higher brain coherence. Similarly, I'm having my Rick Perry moment. It's athletes and what was that other group? Business folks in Norway. The higher they are in the pecking order, the more brain coherence you see. The managers have high levels of brain coherence and the line people much lower. So TM promotes brain coherence, and brain coherence is associated with higher levels of competency and success. And indeed, to close the loop, TM can actually make people more successful and more competent. So that's the transformation part. And we can talk a little bit more about that later. So it's not just healing, it's also transformation. That's the prefrontal part of the brain, that's the CEO. And over here is a deep-seated brain nucleus called the amygdala, which is the brain's alarm center. And I've said if the CEO, if the prefrontal area is the CEO, then the amygdala is the fire marshal. You know, if there's a fire in the building, then the fire marshal takes over and everybody else got to get out of the building, including the CEO. But most of the time, he should stay in the basement and mind his own business. CEO does not need the fire marshal knocking on his door. And that's what happens when we're in a state of anxiety. We keep getting these knocks on our door. We better worry about this, we better attend to that. What about this? What about that? And the first thing is it's overwhelming, because we're being overwhelmed in many instances with trivial things. A client comes to mind. He works for a big medical bureaucracy, and every time an email comes across that they're changing some policy or something, he's always worried, now what's that going to mean? Is it going to be more work for me? Is it going to mean I'm going to have to make paperwork? What I'm going to have to do? And so he's being badgered unnecessarily by things that probably aren't going to mean anything to him. So the trouble is you're being flooded with anxieties. This is in an anxiety disorder, or people who are anxious, or people who are overstressed, which I think maybe one or two people in the room could probably identify with. Or if they've been overstressed, their bell has been gone over in Iraq or Afghanistan, and now they're back in the US, but the bell is still vibrating in their head. Their amygdala is still on high alert. And so they're flooded with these stimuli, and worst of all, they can't discriminate which of these knocks on the door means the building's burning down, and which is just the fire marshal out of hand. So you have to pay attention to each and every one of them, because you don't know which one really needs your attention. Very, very bad state to be in, a state of anxiety and overstress. Now here's just an example of two kinds of brain waves, and here's an example where the ones over here are coherent and those are not coherent. And I think you do not have to be a neurophysiologist to see that these line up and these don't line up. Can be as simple as that. And when you do TM, this kind of pattern becomes this kind of pattern. And it's intuitively apparent that the brain, the different parts of the brain are working together. You're going to have a battle. You're going to have your different platoons coordinating with each other. Or if you have a complex business plan that you want to implement, different sub-fractions of your team have got to be working in concert with one another. That's what TM seems to promote. Now let's talk about healing. Here are two arteries. Would you prefer to have this one over here or this one over there? I think the answer is simple. On the other end of the artery sits an organ. It could be a heart, it could be a brain. This artery, this organ is in good shape because the artery is clear and it's being fed with blood, with high oxygen levels. This one has got atherosclerotic plaque going into its lining, and so it's being clamped off, and this organ is in trouble. And if it's the brain, you'll have a stroke. And if it's the heart, you'll have a heart attack. And we all know there's cholesterol and one thing and another, but there's also stress that's a factor in this process of progression of atherosclerosis. Cardiovascular disease is the #1 killer and cause of disability in the world. In the US, more than 1 in 3 people have been diagnosed with it, and more than 1 in 3 people will die of a heart attack or a stroke. So this is a big ticket item. Blood pressure is one contributor to this cardiovascular disease. It's been called the silent killer
and it's a good term because it often is silent without symptoms and it really does kill. In a meta-analysis with 9 published studies of more than 700 subjects, see what TM did to the systolic and the diastolic blood pressure. Lowered at several points in a way that's not just statistically significant, but also clinically significant. Highly clinically significant, as we'll see in a minute. Now, I love this slide because it shows a variety of stress management techniques. Here is TM's effect on blood pressure, and here are 3 other groups, and here is one that actually makes the blood pressure worse. So, you know, it's a marketing thing to call something a stress management technique. It doesn't actually mean it manages stress. In fact, the people in that group were asked to do too many things, and they were more stressed than they had been before. So, when somebody says they're meditating or they're in a stress management technique, the question is, what kind, what effect is it having on you? Now, atherosclerosis actually can get reversed. This is the carotid artery, the artery in the neck, ultrasonography, showing a controlled study comparing this 29 subjects and 31 subjects, health education, where you see a progression of that atherosclerosis, and TM, where you see an actual regression of atherosclerosis. Because in its early phases, it's reversible. In late phases, where there's calcium there and stuff, you can't reverse it, but you can in the early phases. And the TM can do that. Now, this is another parameter, and I won't belabor these. This is left ventricular mass, big left ventricle, bad news. Health education, the ventricle goes on enlarging. TM holds back the enlargement of the ventricle. Insulin resistance, I'm sure we've all heard about it. The belly fat that doesn't let the insulin push the sugar in the metabolic syndrome, reduced by TM, increased by the control, which is health education. So we're seeing all these different things that TM is actually doing in randomized controlled studies. Now the question is, okay, so does it really make a difference? Well, I imagine the researchers sitting around saying to one another, you know all those people we put through controlled studies all those years ago, I wonder what happened to them. Did they keep meditating? Did they have a different outcome? Did it prolong their lives? Did they die more or less than other people? We don't know. We didn't follow them up. Too bad we never had enough funding. And then somebody says, well, what about looking at the death records of those people? There are national death statistics, including the cause of death. What about looking at the ones that got TM and the ones that got the control and see if it made a difference? Well, to their amazement, there was a 23% reduction in all causes of death, and a 30% reduction in cardiovascular death in those who had had the TM an average of 7 or 8 years earlier. Can you imagine? They don't even know if these guys kept meditating. And yet 7 or 8 years later, it made a greater impact on the mortality than many other things that we might be doing for our health. They repeated it. This is Robert Schneider's work from Monash University, but published here in the Archives of Internal Medicine, top-class journals, where the reduction in death, heart attack, and stroke over 5 years was reduced by almost 50% in a group of people who were at risk for cardiac problems, who were getting all the usual standard of care treatment. That means cholesterol-lowering drugs, blood pressure-lowering drugs, seeing the doctor, etc. This one extra element can make so much difference. Decreased hospitalization and outpatient visits. This is Orm Johnson's study. I won't go into the details, but they are significant. And here's an interesting study from Quebec, where they looked at people, the cost of medical care in people who did not meditate versus people who meditate. And this line over there, where it turns from white to beige, that's the nodal point where people start meditating. What you see is the costs of the medical care lowered in the meditators and going up in the non-meditators. And this is even more prominent in those over age 65. So, do we have a healthcare problem with costs? One thing? Do you think we've got healthcare cost issues in this country? Well, somebody should come and look at the slide. Anybody know President Obama personally? Would be nice to show him these slides. Because this is a very simple thing. I mean, if you think of the cost of teaching somebody to meditate, because basically what you're doing is you're empowering a person. You're empowering a person to take their health into their own hands, to give them a technique. It's the same as if a person exercises. They're getting a technique that's going to help their longevity, that's going to help their health. This is another technique. But exercise pushes the autonomic nervous system one way with an increased sympathetic drive. Your heart rate goes up, your pulse goes up, everything is go, 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 and that conditions the sympathetic nervous system. We all know that. It's really, really good and important to do. This conditions the parasympathetic nervous system, the capacity to wind down, to relax. How many of us are go, 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 go all day long? We don't know how to shift gears. All right, show me by a show of hands. How many of you are pushing yourselves too hard all day long? A lot of hands. And you know, we get exhausted. And this is a way of saying, I care enough about my brain to give it a rest twice a day. And now I actually have a technique. Because if I said to a bunch of people, rest your brains, you wouldn't even know where to start. But here is a tested technique for resting your brain in a way that you know, statistically, over 5 or 10 years, is probably going to prolong your life. So, it reduces anxiety. This is a meta-analysis, and I've got some wonderful examples in my book. David Lynch, filmmaker, iconic filmmaker, gave me an interview and said that after he'd been meditating for a couple of weeks, his first wife came to him and said, "What's the matter?" He said, "What do you mean, what's the matter?" She said, "Where's all your anger gone to? You were so angry all of the time." Now, as a psychiatrist, I can tell you that very few people come into my office because they're angry. Many people's wives come into my office because the husband is angry. Anger problems are something that is always somebody else that's got the anger problem. But here she said, your anger is better. Tim Page, he's a Pulitzer Prize-winning journalist, was kind enough to interview me, or let me interview him, shall I say, and he had experienced panic disorder that was amazingly treated with meditation. These guys have been meditating now for 30 to 40 years. When you get something that helps your anxiety that much, you just don't stop doing it. The third case in point is a neuropsychologist in the Washington, D.C. area called Bill Stixrud, who's got a fantastic practice there. He's one of the best known in the area. And he had kind of flunked out of college because he was so anxious many years ago in Seattle. And in the course of 1 week, two separate people said, "You're the most nervous person I've ever seen in my life." Started to meditate, got back into college, changed his major to psychology, got his PhD, no problems, has this amazing practice, has never stopped meditating. And if you were around him, you would not think he was an anxious person. It's a pleasure to have lunch with, pleasure to be around. It's really, when you see stories like this, and then you see data like that, it goes together. You've got the meta-analysis, somebody's gone through and crunched the numbers, and then you've got the individual stories. And you know, it's very easy for a placebo effect to last 2 weeks. But I have never seen a placebo effect last 40 years. It's one heck of a placebo if it does that. So we're back to the CEO, the prefrontal cortex and the amygdala. That's what's problematic in anxiety disorders, but also there are other things, even attention deficit disorder. There are prefrontal problems there, and if you've got ADHD and you're stressed, guess what? Makes your ADHD worse. You're more likely to forget your homework. You're more likely to not be able to do your term paper. And so it's actually now being studied in small numbers for people with ADHD to see if you can de-stress these people. There's a simple axiom that I'll give to you in thinking about who can benefit clinically from this technique. If somebody is overstressed, and if that stress is causing symptoms, that person has a high chance of benefiting from this technique. So that covers anxiety, that covers anger management. Angry people are stressed people. Have you ever noticed that when you're under stress, you tend to snap at people? Don't bug me now, I'm busy. Go ask your mother. How many times have I told you that? When does that happen? When you're under a deadline, when you're stressed. Decrease the stress, you're likely to come up with a gentler answer. It's that simple. And I could talk for ages on it, but our time is finite, so let's keep going. Combat-related PTSD, a horrible situation. 1 in 7, some now say 1 in 5 returning veterans from Iraq and Afghanistan have PTSD, many times compounded by traumatic brain injury. Half have never sought treatment, half have been treated, have been inadequately treated. There was a controlled study from the post-Vietnam era, and the TM was superior to the psychotherapy of the day by a good margin. And we have now got our own little study, case series of 5 people, and this is the gold standard PTSD scale, which is decreased by 50% following 2 months of TM training. And these people were really sick. The one guy was numbing his symptoms with vodka. He had sustained an injury he was a driver of a Humvee in Iraq. He'd gone over an IED, it exploded, there was injuries, he felt guilty, he felt angry with his commander who directed him to go along a road that was known to be a hotbed of IEDs. Comes back to the US, he's overwhelmed with anger and fear and jumpiness. And every time he goes over a pothole in the road, he flashes back to the IED in Iraq, and he wakes up with nightmares at night thinking that he's being attacked by the enemy when he isn't. One night he actually has his girlfriend in a chokehold because he thinks she's the enemy. Well, all this settled down after the TM. Got a job, relationship improved, finished college. It was really an amazing turnaround. And we saw it in about 4 out of the 5 people, I would say. The one was really, I can't say there was a persuasive change, but the other 4, we got letters about how this guy now does his TM twice a day. He says the morning one just sets him right for the day. The afternoon one kind of enables him to decompress after a difficult day. He would never stop doing it, he says. So these are amazing examples. So here what I'm really suggesting is we may not have a complete controlled study for every single indication that comes along, but as clinicians we have to use our imaginations and say, could this person possibly benefit? Is this person anxious, overstressed, angry? If they are, let's consider this. I mean, we do have good drugs, but they do have side effects. We know the SSRIs can be terrific. They can also suppress your sex drive. They can cause weight gain. They can flatten out affect. So nothing's perfect. And to the extent that we can add to the patient's well-being with a non-drug form, that maybe we can't stop the drug, but maybe we can lower the dosage and have fewer side effects. It's not an either-or. It's a matter of using everything we can to promote wellness. I love that initial introductory comment. Alcohol and tobacco addictions, I'm not going to go into any great detail. There are 19 controlled studies. And there's an impressive literature on that, but it may be beyond our current conversation. And there's a wonderful schools literature, schools where the kids are stressed. Visitation Valley Middle School is in a slum in San Francisco, and the kids there were creating so much pandemonium. One of the researchers said that the first day he walked there, there was a huge teenage kid banging a garbage can against the wall of the corridor. And the Jim Durkee, the headmaster, wonderful, wonderful guy, went on to get for his work here the Middle School Headmaster of the Year award for the whole United States. Thousands of headmasters and headmistresses, principals competed for that honor. But they came to him, and the day before he was to go to Visitation Valley, and they said, we couldn't find a suitable principal, so we thought you'd have to do the job. He went there and he started doing the job, and he just didn't know which side was up. And at that point, the David Lynch Foundation, which supports TM for many different groups that need it, can't afford it, were offering San Francisco schools a grant to teach it, and he said, I'll take it. Well, this is what happened to attendance before and after what was called the Quiet Time program. School one, that was Visitation Valley, attendance had been dropping, it turned around. Likewise in a second school, it had been dropping and turned around. Same with grade point average, down and then up, down and then up. And in particular, what's called the holy grail of education is to close the education gap, to help the lowest performing students perform a little higher. That's one of the hardest things to do. It helped close that gap. So why is this? Well, when you're on your way to school and you have bullets whizzing and you see a corpse on your way and you think that the next one could be you, and you land up in your classroom, you don't exactly feel ready to study algebra. Your brain is in shock. And so the principle behind what's called consciousness-based education is first get the student in a mentally receptive state of calm alertness. Does that sound familiar? If somebody's calm and alert, that's when they study best. If somebody's traumatized and stressed and worried about their family, worried about their safety, they're not going to be able to learn. So that's why, even though these people need so many things, they need food, they need shelter, they need math teachers, they need all kinds of things, one of the things that these educators are recognizing is that they need calmness, they need focus. That's what the TM has been able to give them. Maslow's hierarchy of needs. All of us who've studied psychology have learned it. This is the pyramid. At the bottom are all the things. We need food and warmth, we need security and safety, we need intimate relationships, we need to feel we've accomplished something. But right at the top, we really feel we want to be the best we can be. As Maslow says, artists need to paint, musicians need to make music. We all have that part of ourselves that strive to say, we've got this special little gift and talent, we just really want to fulfill it. It's called self-actualization. All of us want to, whatever it is we really do, we want to be proud of it, we want to do it the best way we can. This has actually been shown to improve dramatically with TM. So that's why I talk about transformation, because it doesn't only prolong your life, it doesn't only prevent heart attack and stroke, but it can turn around a school that's in distress, it can help an addict recover, it can help these terribly anxious people be incredibly functional human beings. Film director David Lynch, neuropsychologist Bill Stixrud, Pulitzer Prize winning journalist Tim Page. These people were disabled by their anxiety and are now leaders in their different fields. That's what I mean by transformation. And studies where they've actually got scales of self-actualization have shown that it can increase people's ability to self-actualize. The book Transcendence, it was the easiest of all my books to write. And I think it was because of being meditating myself, feeling the joy of the creative process, feeling the flow. There's an author called Susanti Mahaley who wrote a book called Flow, which is all about being in the moment and feeling like the moment is very exciting and very moving. Whatever it is that you do which engages you and fascinates you and thrills you, when you're doing it, it's almost like time stands still. And this promotes the feeling of flow and the feeling of, yes, this is what I want to do. Well, recidivism in jails, I'm not sure it's of any immediate relevance, hopefully to anybody in this group. So we'll skip this slide. But it helps. And harmony. What do I mean by harmony? Well, in my experience, people who meditate, it promotes harmony. It promotes it in one's own mind, in the coherence where different parts of the mind are working in better harmony with each other. It promotes it between mind and body. The mind isn't hurting and stressing the body. It promotes it in families, couples who meditate together, stay together, because they're bringing this calm lagoon of peace into their home on a daily, twice daily basis. It brings it in groups. What we're seeing now in the last year in particular has really stepped up is groups of people, organizations embracing TM. Oprah Winfrey has just had her whole organization trained in this technique. She can certainly is in a position to choose which technique she wants her people to learn. They're all learning this technique now, and other organizations are following. Why is that? Because those of us who've worked in organizations know they're not always pleasant places. People are stressed, so what do? They snap at each other, they gossip about each other, they undermine each other. Oh, here's a little memo. Let me withhold the information so that somebody's going to be late for a meeting and looks like an idiot. That'll teach her, that kind of plotting and scheming and machination. That's what people do when they're stressed. Even nice people do that. When you feel happy and content, you want to collaborate, you want to help one another, you want to engender peace. And so I think what's going to happen is organizations are going to embrace this as they see that the cost of training and the cost maybe of even giving somebody 1 out of their 2 TM times in the workplace. We'll give you a matching period. We'll give you one and one is on your time. And that sort of thing may end up really repaying itself, because if you can get greater harmony in the organization, that's worth a lot. And then, of course, the question of harmony within societies, which has been studied and debated and maybe a little bit beyond our discussion here, other than to say that the more people who are distressed and focused and centered and kind to one another, the better the group is going to become. In some ways it's pretty self-evident. So maybe I'll leave it on that note. Thank you.
נעזוב בזה. תודה רבה לכם.